Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about high blood pressure during pregnancy. Your blood pressure is so important during pregnancy that your doctor checks it at every prenatal appointment. Blood pressure is the amount of force exerted by blood against arterial walls. Normal blood pressure is less than 120/80, but it can change during pregnancy. Why is blood pressure important during pregnancy? When your blood pressure rises, your blood vessels contract. This means less blood will flow to the placenta, and less oxygen and fewer nutrients are available for baby. This can lead to problems for baby. If you've had high blood pressure before pregnancy, you have chronic hypertension. With chronic high blood pressure, you have a greater chance of pregnancy complications. Your condition must be controlled during pregnancy. When high blood pressure occurs only during pregnancy, it's called pregnancy-induced hypertension, PIH, or gestational hypertension. The problem usually appears after 20 weeks of pregnancy and disappears after baby is born. Because high blood pressure doesn't usually have symptoms, it may be difficult to determine when it begins. If you're overweight or obese or have diabetes, your risk increases. With PIH, the systolic pressure, the first number, increases to higher than 140. A diastolic reading, the second number, of over 90 also indicates a problem. An example is a woman whose blood pressure at the beginning of pregnancy is 100/60. Later in pregnancy, it's 132/91. This signals she may be developing high blood pressure. PIH develops in 5 to 8% of all pregnant women in the United States. Complications with high blood pressure during pregnancy can include intrauterine growth restriction, preeclampsia, eclampsia, stroke, placental abruption, and labor induction. PIH can affect your baby too. It can cause premature birth and low birth weight in baby. Babies born early can have breathing problems and increased risk of infection and other problems. If you need medication to control your blood pressure during pregnancy, your doctor will prescribe the safest medication and dose. In some more severe cases, your doctor may recommend bed rest. There are ways to help deal with high blood pressure during pregnancy. Stay active. Do some physical activity every day, such as walking or swimming. Eat a balanced diet and watch your salt intake. Ask your doctor for advice about how much sodium you should take in each day. You need some sodium, just not too much. Stay hydrated. Dehydration can lead to high blood pressure. Drink about 100 ounces or 3 liters of fluid every day. 50% should come from water. The rest can come from other beverages and foods and water in foods you eat. We have seen articles in magazines and newspapers that incorrectly equate high blood pressure with preeclampsia. They are not the same problem. High blood pressure is one common sign of preeclampsia, but it must be accompanied by other serious symptoms to be diagnosed as preeclampsia. We discuss preeclampsia in another podcast episode. If you have high blood pressure, Follow your doctor's advice, but don't panic. Your doctor will check your blood pressure at every appointment to see if it is within normal limits. If a problem arises, your doctor will advise you. To help protect yourself and your baby, be sure to keep all your prenatal appointments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be.